Hey everyone, welcome back to my channel. Today I'm doing my 8-month update on my FUE hair transplant, which I did in Turkey, in Istanbul. The clinic was Cosmedica, and I've already talked about the process of my research, how I picked the clinic. I talked about what is the actual surgery, how it went, what it entails, the prepping process and the actual process, the recovery as well. I've covered over the last 7 months now. In this 8-month update, I'm going to go through an article that breaks down the recovery process, and I'm going to discuss whether this is the same for me, how it went, and compare my results with what is typically recommended, what people are discussing as the usual process. So let's dive in. Alright, so as I was preparing for today's video, this is my 8-month update, as I said. So I've done quite a few videos already, and I have addressed all of the important stuff. So if you're just doing a research, or you're preparing for a hair surgery and you're watching videos, you will find a ton of valuable information in the previous videos. So I wasn't really sure what to do today. What can I talk about that I haven't actually already covered in the previous videos? And as I was just researching, one of the first results that popped in my Google search was this article here. It's called FUE Hair Transplant Recovery Timeline. What to expect month by month. And I thought, okay, well, this is great. Now we can actually go through all of the main points here, find out what is generally being discussed in terms of recovery, what is expected to be the recovery process. And now I can compare with my actual results, with my personal experience, and see what is the overlap and what are the differences. So let's start. Well, first they say, in short, FUE hair transplant recovery follows a clear timeline, which I'm a little bit surprised because people are quite different, and recovery would differ depending on quite a few different factors. But nonetheless, they say clear timeline with initial healing in the first week, shedding and dormancy in the first 3 months, and visible regrowth from month 4 onwards, leading to the full results by 12 months. Right off the bat here, I must say that yes, initial healing was in the first week, shedding was in the first 3 weeks. Dormancy, however, is not something that I experienced, so I'm going to talk more about that. Now, next point is individual results may vary depending on healing speed, number of grafts, post-treatment care, and practitioner experience. And then they say visible regrowth from month 4 onwards. I would say visible regrowth was happening in the early weeks as well, in the first weeks, leading to full results by 12 months. This is correct. This is also what my hair surgeon and the practitioners, the technicians, everyone mentioned in several discussions that I had with them in Cosmedica. They all say that 12 months is really necessary to see the full effects of the hair transplant. So now that it's been 8 months, bear in mind, we are probably 3/4 almost there, but it's not 100% quite yet. It's supposed to be somewhere around 60 to 70% of the effect is now visible, and I'm gonna show you what is my hair looking like. Actually, let me do that right now so that we can move forward. So this is pretty much my hair just washed a couple of hours ago. I did not apply any products or anything at all, so that we don't have, it's not styled or anything like that. So you can see the thickness of my hair, you can see the density. I mean, my hairs are typically thin. I have thin hair, and that's just the structure of my hair. Of course, it's improved because I've been taking supplements over the course of the last 8 months, and these were biotin, saw palmetto, and there was a complex formula pill with a lot of different vitamins and minerals and things in there. I'm using this serum, which is also provided by the clinic, and I still have 2 of these left. All of these were provided by Cosmedica, the clinic that I selected for my hair transplant. I cannot guarantee that every clinic is providing a supply of supplements for free. They might be part of your package, might not be part of your package. This is pretty much my treatment. Now, for the last 3 weeks, I started using this thing as well here. This is a hairband, and I did a video about it. It's a mechanical treatment, mechanotherapy. So it's something that's natural, and I will be reducing the supplements that I'm taking, and orally at least, and I will focus more on doing things that are more natural or a topical application and stuff like that. So let's move on with the article so that I can break it down. We start with what influences your FUE hair transplant timeline. Healing speed. Everyone heals differently depending on age, genetics, and overall health. Well, this is a very good point, because in the beginning, the opening of the article was claiming that it follows a clear timeline, and now we find out that everyone heals differently. So it's not going to be such a clear timeline. Number of grafts transplanted is another factor. Larger sessions may require longer recovery. In my case, I had 4,000 grafts during my initial consultations, and I did a few consultations with different clinics. We discussed 3,500 grafts upwards to 4,500 grafts. Over 4,000 grafts was going to take more than 1 day of surgery. It was going to roll over onto a second day. So I decided that I didn't really want to extend it so much, and I thought if we can fit 4,000 grafts in 1 day, then I'll just do that. And this is what we did. They said that the maximum you can do in 1 day would be 4,000. They don't recommend going any harder than that because it's going to stress the area too much. That's why they want to allow the area to rest for the night and then continue on a second day. So typically they would do around 3,000, 3,500, maximum 4,000 grafts in 1 day. And I decided to go for 4,000. Right. Post-treatment care is another very important factor. As I said, in my case, I did have a lot of supplements that were provided by the clinic. Technology and technique, and also practitioner skill are some other factors that will play into this. And in my previous videos, I was actually talking about the fact that these days there's even machines that can do these kind of operations, these surgeries, you know, the procedure and stuff. But I wouldn't recommend it just because I feel that there is a little bit of artistry as well involved in the procedure, and you really want these hair follicles to be transplanted in the, you know, in the right places, especially here in the top area where your hair grows into sort of a spiral. One of the surgeons that I consulted with was trying to convince me that this is not an area that you should be transplanting into, and that, you know, once you get the hair density here proper and everything, you wouldn't really be seeing much of that part, something like that. I mean, clearly the guy didn't really want to be doing it because it's more elaborate or something, and we didn't have a problem with Cosmedica. I did bring that up, and they reaffirmed and reassured me that they actually will be following exactly the direction of the hair here, so there is no problem to do it. And you can see in my videos here, and of course that part here in the middle is a little bit less dense than the rest of the head, which is actually normal. So definitely make sure that you're going for a procedure that will be manual rather than automated with a bot. All right, so week 1, initial healing and aftercare. What to expect? Mild redness, swelling and scabbing at donor and recipient areas. And this is true. In the first couple of days, you have a bit of swelling. Cosmedica provided me with a hairband. They also provided me with a very soft cap that was mainly to prevent from dust. So this is what I was using for the first few days. Also, they say you can expect tightness or numbness around the scalp. This is also true. The tightness is mainly because you have a bit of swelling. So it wasn't painful. I did not feel any pain on my scalp unless I actually touch it. Now, as I touch it, the area was feeling quite sensitive. Again, not exactly painful, but definitely sensitive. And that went on for the first 3 weeks. By the end of the first month, I would say it became less sensitive. It was really sensitive for the whole of the first 4 weeks. They also say sensitivity when sleeping or washing the hair. Now, washing, in my case, I was advised not to rub the hair at all. I was only applying a foam that they provided for me for the first week. I was only allowed to touch, just tap the head as I'm applying the foam, and also as I'm washing the hair. I was not allowed to be using the shower head. It has to be all very mild and very soft and gentle and everything, right? So this is true. All of this here is true. Sensitivity when sleeping, not really so much when sleeping, only during washing or touching the head. I was also supposed to be sleeping elevated, and they actually say this in the care tips here. They say sleep with your head elevated to reduce swelling, and Cosmedica provided me with this neck pillow that was supposed to elevate the head a little bit so that it's not pressed heavily on the pillow, because you don't really want to be suffocating these spots that have just been treated. And it's not very comfortable. It takes a little bit of getting used to sleeping like that. Also, they say avoid strenuous activity or sweating. So not only that, I would also add smoking and drinking was also not permitted for at least a week prior and after the surgery, because they affect your blood circulation, and blood circulation is very important for the healing process. So in the first couple of weeks during your healing process, you don't really want to be doing anything excessive in terms of physical exercise or smoking or drinking. Also, they say back to normal activities. Most clients return to work within 2 to 5 days. That is true. Your focus or your ability to work is not affected by this. Of course, it depends on what type of work you're doing, because if it's going to be a physical labor, you might not want to be doing it in the first 5 days. Physical labor, you should shy away for at least a couple of weeks, right? Physical activities, they say, can usually resume after 7 to 10 days, which is exactly what I said, a couple of weeks. All right, week 2nd to 4th, shedding phase, shock loss. What's happening? Transplanted hairs begin to shed. This is completely normal. This process is known as shock loss, and it is a temporary phase. Some redness and or patchiness may still be visible. It's interesting because in my case, I didn't really have any shedding of hairs. The shedding was mainly scabbing, in fact. You can say like dandruff, but you could see that it's actually, a little bit of dead skin that is coming off your scalp because your scalp was distressed during the procedure. You don't really have scarring. This is important. You don't have any visible scarring, but the skin has been distressed, and from that you actually get a bit of shedding of dead skin. But more importantly, I did not lose any hairs. I did not have any hair loss at any point during my recovery process up until now. It's 8 months already. I mean, when I'm washing my hair and everything, I do see that some hairs are falling off, but nothing more than the ordinary. Shedding, they say, is a part of the hair growth cycle. Your follicles remain intact. New hair growth will begin from the same follicles in the months to come. Month 2 to 3, dormant phase, they say. What to expect? Very little visible change. I must admit that, yes, second and third month, the change was starting to slow down. I was still having hair growth. You can see in my progress that the hair is visibly getting longer and bigger and everything. But in the first weeks, it was a very rapid kind of growth, and because it's so short, you can actually see the progress very easily. And then during the second and third month, as it starts getting to around a centimeter and above, it just starts making less of a difference. It's still growing, but probably we can agree that it's not that much of a difference compared to week 1 and week 4, or week 1 and week 8. What's happening beneath the surface? Hair follicles are entering the anagen, the growth phase, after a resting period. The groundwork for future growth is now underway. Be patient. It may seem like nothing is happening, but your follicles are active beneath the scalp. Fair enough. Month 4 and 5, early hair growth, visible changes. Fine, thin, vellus hairs begin to emerge. Some areas may fill in faster than others. Hair is still too short and light to style. Individual variation. Not all patients will see the same level of early growth, and some may experience faster development due to genetics or graft density. So probably this was my case because, as I said, I was experiencing the hair growth from the beginning and I never really had a real dormancy period. And also the thin hairs started growing by the second month. In fact, this is what I was talking about in my second and third month updates, mainly the fact that the hair was looking like baby hair. It was really fine and thin and everything, and I was waiting to see when are they going to turn into kind of thicker, more normal looking hair. And that happened around the end of the third, beginning of the fourth month. Alright, moving on, month 6 and 7, noticeable improvements. Hair starts to thicken, darken and gain texture. With me, this already happened during the fourth and the fifth month. More even coverage across the treated areas. Yes, this is true. I would say that you are definitely seeing that the hair is getting a little bit denser, and clients often report a boost in confidence. In my case, the boost of confidence actually started around the fifth month when I was able to already start styling my hair. You can begin cutting and lightly styling your hair. I started cutting my hair around the 5th and 6th months, and at first only on the sides and only with scissors. I was instructed not to be using machines in the first few months, at least in the first 6 months, and I'm still not using machines. I'm going for a haircut with scissors. And month 8 and 9th, they say maturity increases. Hair density improves significantly. The hairline begins to take on a natural pattern. Transplanted hair blends seamlessly with native hair. What's normal? It is common to see faster progress now compared to earlier months. Most patients feel comfortable and satisfied at this stage. As I said, already for me, by the 6th month, I was entirely satisfied with everything. Now here's what I can expect over the next 3 months. Month 10 to 12. Final density and texture are established. Transplanted hair looks, feels and behaves like natural hair. You can wash, style and cut it as you please. To be honest, I'm already there. I feel like I'm already at this stage, even though I'm waiting for final density and texture. But washing, styling and cutting hair as I please, I'm already doing that. And transplanted hair looks and feels and behaves like natural hair. It does that as well. At first, because I'm wearing my hair always going this way, which is right, at first the transplanted hair wanted to go straight down and even a little bit to the left, which I wasn't very keen on, just because this is already in a habit. I mean, I'm approaching 50, so at this point I already have established a lot of habits, right? So I really wanted to continue styling my hair the same way, and I was a little bit worried whether I'll be able to, because it looked like the hair that was transplanted here, they did lower my hairline, so I did have a whole centimeter here of hairs that were transplanted. As you start combing your hair a certain way, eventually it will take on that shape, and that's exactly what happened. By the 6th month, when I was able to really style my hair and everything, it started taking the shape that I wanted it to, so no complaints. And last but not least, tips for a smooth hair transplant recovery. They say follow post-treatment instructions precisely, especially in the first 2 weeks. Avoid smoking, alcohol and excessive physical strain during the early healing stages. I don't know why they didn't say about smoking and alcohol earlier in the first point, because I feel that they should have. Attend all follow-up appointments to track your progress. Be patient. Hair growth is a slow and gradual process. And to sum it all up, I'm gonna go to the frequently asked questions. So the first one is, when will I see hair transplant results? So apparently this is the most asked question. Most patients begin to notice visible hair growth around 4 months after a hair transplant. I would disagree here. It could be that, my process was a little bit different than the usual, but I doubt it. To be honest, you see it from day one. On the second and third day, I already started seeing, the hair started growing. You can see it on my pictures as well. So this is my actual progress, and I didn't have to wait for 4 months to see visible hair growth. It was immediate. They say months 1 to 3, initial shedding phase, which is normal. Month 4, early signs of new hair growth. With me, it was immediate. Months 6 to 9, noticeable thickening and density improvement. I agree here. And months 10 to 12, this is for me in the future. So these are final results with full hair volume and natural appearance. Every patient's growth timeline can vary depending on factors like hair type, transplant technique, and overall health. And I'm in very good health. I'm 48, I'm not yet 50, and knock on wood, so far everything is fine. We did, blood pressure and cardiological assessment and other things as a kind of, they did a few tests prior to the surgery, and all of my results, at least what they told me, were excellent. They also say that around 70 to 80% of patients see initial growth by month 6. So if you don't have initial growth by month 6, then perhaps something is going wrong. I would say that even waiting for 6 months to see initial growth would be weird, especially considering that with me it was immediate. Again, this is my personal experience. It could be very different from other people's experiences, and this is why we are recording these videos. This is why we are tracking our progress, and I'm doing it month by month, and other people are doing that as well. So in your research, I would encourage you to watch all kinds of videos from different people so that you can collect different opinions, different experiences, and make up your mind what is going to work best for you. Hopefully, this video helps you in your research, and if you have any questions or any suggestions, do drop them in the comments below, guys, because this is going to help me to create more valuable content for you to address concerns and questions that you actually have, my viewers, my audience. And thank you everyone for watching my videos. If you're new to the channel, again, I would encourage you to subscribe, hit the notification bell so you know when I'm posting a new video. And I'm trying to keep the content quite variable here on this channel. I'm not only posting about hair transplant, I'm posting about everything that interests me. So this is Ox Earth. Thank you for staying until the end of the video. And while you're here, just pick another one and I'm gonna see you there.